we are all ready to go, as long as no one is waiting for other folks to join, but I think everybody's here, so I think we can get started.
Awesome. Well, thank you all so much. With that, we're going to start our press conference today on something so monumental. It's something that we've been fighting for so long. But just again, to go over some housekeeping rules, of course, as we've all learned to operate virtually, some things to remember. And of course, we also want to be inclusive to all of our families throughout New Mexico who are attending and watching and participating. So with that, for those that are on the Zoom link, there is interpretation available. If you go down below, you will see some options. There's a globe. It'll say interpretation. Please select the language that you are most comfortable in listening to and participating in. For members of the press, we will have an opportunity at the end to do a Q&A for folks. But of course, we're going to have you, if you have any questions throughout, go ahead and use the Q&A option, put in your question at that point. That way we can kind of field it to the right person towards the end. And I definitely appreciate that. And for those that are watching virtually through social media, thank you all so much for attending this press event. Again, for Zoom etiquette, I guess, for those that aren't speaking, please make sure to mute yourself. It's always kind of distracting when we hear some background noise, and be respectful of the speakers. And for the folks that may not be speaking as well, to turn off your video, as we'll be hiding all of our participants soon that aren't speaking. So again, my name is Lan Senna. I am currently the policy director for the Center for Civic Policy. I was also a former city councilor, where paid sick leave was something near and dear to my heart and something that we've championed here at the local level here in Albuquerque. So I want to take us all the way back as to how did we get to this day. I want to just note that as we're talking about it, I just want to mention that so many of our families, our workers, our communities have been in this fight for so long. Really, it's been since anyone's gotten sick and needed to take this time off. But the real legislative fight started back in 2015 or so when Fair Workers Week started, and it really resulted in this fight here in Bernalillo County of trying to get on this ballot so that voters can have their input to speak to really the challenges that we were all facing. When we hit some roadblocks there, we didn't give up. We went back to the city and said, city, we need your help. We want to get on the ballot. A lot of workers pushed back on this narrative that we shouldn't be able to voice our own struggles and need for paid sick leave. So as the county ended up adopting their own policies for paid sick leave, we knew we couldn't stop there. Even I myself, while on the Albuquerque City Council, made some attempts to also push for paid sick leave while on council. And we know that there was a vote and there was a ballot measure where it did not pass with 768 votes, but only to see that 6,000 voters or so did not turn the ballot on the backside to even see that paid sick leave was on their ballot to vote for here in Albuquerque. So with all of these struggles, we knew we could not stop because so many families, while in this fight since 2015 and longer, we knew that cancer patients, kids were going to chemotherapy by themselves as parents didn't have access to paid sick leave. We knew that people were going to work sick just because they just did not have the ability to even afford missing an hour of the day to go to their loved ones' appointments to seek that preventative care. So we knew we could not stop, and so thankful that we have great champions that we'll hear from today and their fight for working families, for all of our communities in the fight for paid sick leave, which ended up passing. And thank you all. We will have a real opportunity to really thank our champions. But again, this whole movement was led by workers. I remember as folks were calling in, whispering on their lunch breaks about how paid sick leave would impact them and how much this would help their families. So really to do a deep dive onto what passed and what opportunities do working families in New Mexico really have an opportunity starting tomorrow. And with that, I'll turn this over to Felipe at New Mexico Center on Law and Poverty to tell us what is in the legislation.
Thank you, Lan. As we're setting up the visuals, I'll introduce myself and kind of get going so that we can make sure we have enough time to get through all of the amazing workers and advocates that are here to speak to us about this policy. As Lan said, my name is Felipe Guevara, and I am a workers' rights attorney at the New Mexico Center on Law and Poverty. At NMCLP, we support low-income New Mexicans through community advocacy, litigation, and policy work. For years, we've worked with this amazing group of individuals to pass a paid sick leave policy in New Mexico. Thank you for your tireless work. Today, we are here to highlight some of the most important aspects of this law that passed in 2021. So the first thing we'd like to highlight is how much you can earn and what are other things around paid sick leave. And the first thing to keep in mind, and that's really important, is that for every 30 hours worked, a worker earns 1 hour of paid sick time off or paid sick leave. Also, current employees will begin earning paid sick leave tomorrow, right when the law comes into effect and right when you get to work. For those looking for a job, you will begin earning paid sick leave the first day on your new job. Employees can use 64 hours of earned paid sick leave within a 12-month period. Employers, however, may authorize further hours of paid sick leave within that 12-month period. So while 64 hours is your minimum, an employer can give you more in that 12-month period. Importantly, retaliation against an employee for requesting or taking paid sick leave is illegal. Now, who has the right to paid sick leave? Employees that need treatment, recovery time, or preventative care for a mental or physical illness, injury, or health condition may take paid sick leave. Employees that have a loved one who needs treatment, recovery time, or preventative care for a mental or physical illness, injury, or health condition can also take paid sick leave. And when we say a loved one, it really is an expansive term that includes anyone within that family, anyone you would consider a family member. If you need, and by you, I mean the employee needs to take time off to deal with domestic abuse, sexual assault, or stalking, those individuals also have the right to paid sick leave. Or if you're obtaining services or assisting a family member of the employee with any of the above activities. So an employee who's assisting someone or who is doing any of the above activities also has the right to paid sick leave. Now, what are your responsibilities when taking paid sick leave? An employee should inform employers as soon as possible, in writing or orally, when they need to take paid sick leave, and they should try to tell them how long they will need to be out. The employee requesting leave is not required to search for or find a replacement worker. And employees do not need to provide documentation proving that you took sick leave for a valid reason unless you take 2 or more consecutive workdays. Finally, how are rights enforced under this law? If an employer violates your right to paid sick leave by not giving it to you, by simply not letting you accrue it at the rate that you're supposed to, or any of the other rights we've discussed about today, but if they violate this law, you may sue your employer in a civil court, or you can initiate a complaint against the employer through the Department of Workforce Solutions. There are many different organizations, some of us here today, that can help with these processes. Thank you so much for giving me this time, and I look forward to hearing from everyone else. Thank you.
Thank you so much, Felipe, for that breakdown, and now we'll really hear how it goes into application, hearing from stories and really humanizing policy, because oftentimes as we talk about policy, we forget how much this impacts our families, how much really in real life this plays out. So we'll be hearing soon. And really, as we talk about it currently, as we talk about reproductive health and access to paid sick leave and what that could mean for families as we talk about reproductive health. And I want to remind folks that abortion is still legal here in New Mexico, that if you're seeking services, that you have that ability here in New Mexico, and how much that will mean to so many of our families as paid sick leave starts tomorrow. And just again, as a reminder for folks that are jumping on, we do have interpretation. So again, select the globe and select the language preference that you would like to participate and engage in this meeting. So now we're going to hear from folks that really led this movement and how it applies and the power of our workers, even though we've felt it, of course, during this pandemic, but what does this really mean? So now I'm going to turn it to Lucila Lozoya and hear from her.
Buenas tardes, mi nombre es Lucila Lozoya y soy una trabajadora esencial del hogar, del cuidado de niños y madre de 3 hijos. Y líder comunitario con el Centro de Igualdad y Derecho. La pandemia impactó a muchas familias trabajadoras de bajos ingresos como la mía, especialmente en cuestiones de salud y estabilidad financiera. Cuando hubo un brote del COVID-19 en mi trabajo, la respuesta de mi empleadora no fue la más adecuada, conllevando a más casos positivos. Durante este tiempo, nuestra empleadora nunca proporcionó días pagados por enfermedad federal, haciendo aún más difícil las decisiones sobre nuestra salud y poder alimentar a mi familia. Aún más difícil fue la decisión, ya que nuestras familias no califican para los alivios financieros, desempleo, ni los otros programas de ayuda que muchas familias podían utilizar durante la pandemia. Finalmente, decidí no volver al trabajo, dado a los múltiples casos de contagio, y además porque mis doctores necesitaban hacerme una cirugía para priorizar mi salud, dado que estaba luchando contra el cáncer. Nunca en mi vida había pasado por aprietos financieros tan extremos como lo han sido estos tiempos. Casi lo perdimos todo. El 28% de los hispanos en todo el estado de Nuevo México ganaron menos de $20,000 en el año 2020. Entre las latinas, esta tasa fue el 35%. Y alarmantemente, el 35% tenía menos de $100 en ahorros para emergencias. El 25% de los latinos de Nuevo México tienen un familiar que murió del COVID-19. Estos datos son impactantes, ya que describen las realidades de familias como la mía. Estos momentos de incertidumbre me hizo realizar la importancia de derechos humanos tan básicos como el acceso a días pagados por enfermedad. Estoy muy orgullosa de ser parte de las trabajadoras esenciales que han estado al frente de esta pandemia y que seguimos organizándonos para mejorar nuestras condiciones de trabajo. Las familias burqueñas han estado luchando para tener acceso a días pagados por enfermedades desde el 2015. Hemos luchado arduamente y estamos felices de que esto finalmente se ha convertido en realidad y que todos los trabajadores en Nuevo México, independientemente de su industria, estén cubiertos. Sí se puede.
Thank you so much for sharing your story, Lucila. I very much appreciate that. And as we know, essential workers really carried us through, and they always have, And we definitely know that, but we truly did feel this during the pandemic. And as we talk about illness and how everyone gets sick, it's not limited to a pandemic. We all know this. And really, it also translates to what we can prevent from things getting worse. And now we're going to really hear from Donna and Steve in this perspective of what paid sick leave means to them. Donna?
Yes, my name is Steve Orgeron. Yeah, I got real sick here a while back in March, and I asked my boss for some time off, and he told me no. So I went to the emergency room. My level of sugar was real high, and so the doctor told me that he was going to give me 5-day note for 5 days off, and I said, okay, so I took it to my boss, and my boss fired me anyways. And I don't think that's right for anybody in the state or any worker to go through that. Especially when I'm the only one working and trying to support their family. It's really hard for a single person, a mother or a gentleman or a man taking care of the kids. It's not fair. I think the law that came out is going to work out perfect for all the employees and all the workers, especially the workers. We should all stand together and unite and go to the legislation. Legislation to when whatever bill comes out, we should support it. I think it's right for all of us to, like I said, unite and stick together.
My name is Donna Orgeron, and I am a healthcare provider. And I think that prevention is so important for workers. If you're able to keep yourself healthy, and this means going to your scheduled doctor's appointments and taking the treatments that are necessary, then in the end, you won't have to take so much time off by getting so sick that you do end up in the emergency room. Steve's experience is like others, I'm sure, where we knew he was getting sick. His blood sugars were not in control because of the stress he was under. He would be granted a day off, but first thing in the morning, he would be called into work. So I would be scrambling to change doctor's appointments, which really never happened because he kept getting called into work. If he refused to work, he would be retaliated against. And they would either take him off the schedule, so no hours earned that week, or they would put him, in some remote area, which took an hour to travel to. So the retaliation that happens to a lot of people happened to Steve as well, and me. So, in order to keep yourself healthy, you need to be able to keep your doctor's appointments. You need to be able to eat lunch. You need to be able to take bathroom breaks. This primary needs are not being met by employers. If they see that you're not at your post, you are retaliated against. So prevention, also businesses would do a lot better as far as having their morale increased. With this law, businesses are going to see that their employees' morale is heightened because they know that they're accruing hours that they can take. Say they even need a mental health day or to take their child to an appointment, or the child is sick and they get to stay home with the child themselves instead of farming them out to who knows where. So I think that businesses will do better as well. And Steve wants to say one more thing.
And it just doesn't happen to, say, I'm not trying to be racist, but to the white folks, it happens to all of us, you know? Doesn't matter what race we are, it happens to all of us. I think if the bosses, the general managers would step down to our position, they would find out how it would be and what we go through.
But they don't even
They don't even try.
ask. They don't meet with you. There's no transparency. So retaliation is abundant though. Thank you.
Thank you.
Thank you so much, Donna and Steve, for sharing that perspective. And as Felipe had mentioned earlier, just the key components of this piece of legislation when it comes to retaliation and really the protections of our workers and what we have now because this bill is going into effect tomorrow, and just really how often we have to fight for our workers, for our families, and just to take even a break. So thank you so much, Donna and Steve, for sharing that perspective. And just as a reminder again for members of the press, that if you do have any questions, you can put that in the Q&A function, and we'll compile those questions towards the end and give them to the right folks to answer. Next, I'm going to really turn it to a real champion of this policy when it came to the legislature, and even beyond that, even in her own community, how hard she has fought for this. One of my favorite representatives from Southern New Mexico, Representative Angelica Rubio.
Thanks, Len. Thank you, everyone. Buenos días a todos y muchas gracias por estar aquí. I'm really happy to be here with you all today and very, very excited for tomorrow and the work that so many of you all have put into this effort for so long. Len, as you mentioned, this has been a long journey to get here. And while it is a relief to know that we're heading into this step forward with paid sick leave starting here in New Mexico, there's still so much work to do. And I just want to give a real shout out to Representative Chandler and Senator Mimi Stewart for their efforts and the collaboration that we had throughout the session. And for those that don't know, this bill, there was 2 different versions when we started that session, and we were all searching for a session that we knew needed to be transformational, considering all of the unveiling of so many inequities in the midst of the pandemic. And so this was one of my main priorities, and I'm so grateful that we were able to get it through. It's one of the amendments that we made was to delay it for a year, and I never thought that tomorrow would ever get here, but here we are. And so I'm really happy, and I just want to say for all of the folks who are listening, particularly all the organizers and the folks on the ground, frontline communities who are having to deal with this issue day to day, that progress takes time, especially in this country. And as we've seen in recent weeks and even today with the Supreme Court rulings, it's actually sending many of our work backwards. And all I can say is that you all inspire me. You all inspire me. And we need to just continue the work, move forward, and knowing that New Mexico is still a beacon and will continue to be a beacon for the rest of the country and hopefully the world when we're talking about issues that are so important to you all. And so I look forward to working with you all for the rest of this year, heading into January. And like I'm used to bringing chaos to the legislature and pushing these really bold ideas. And that's why I love sharing spaces with you all, because these ideas aren't bold. They're ideas that every single person deserves in our communities. And so I'm really looking forward to continuing to work together and to sharing more space with you all. And so thank you for the time to be here with you all. congratulations, because you all deserve that congratulations. This was a win that was hard fought, and there's more to come. So thank you.
Thank you so much, Representative. As we'll hear from your co-sponsors and partners in this legislation, and really the throwdown that did happen in both chambers. So we'll be hearing from Representative Chandler and from our pro tem of the Senate, Senator Stewart, in a little bit. But thank you again for sharing this perspective, for sharing and being in this fight for so long and continuing on, because we know the work continues for protection of our workers, for our families. And I'm sure we'll see that in the next session. So something to look forward to for all of us. Next up, we're going to hear from, even though I shared this perspective of how it really kind of centralized here in Bernalillo County, but really, again, this applies to all of us. This legislation is throughout New Mexico, and so many of our families have felt it. So we're going to really hear from a rural immigrant point of view from Mayela Solano. I'm not so sure if I see her here, but from someone from Somos.
Hola, buenas tardes a todos. Mi nombre es Mayela Solano. Soy miembro del Centro de Trabajadores de Somos un Pueblo Unido. Soy trabajadora esencial. He trabajado por muchos años en la área hotelera y restaurantera en Santa Fe. El tiempo de la pandemia fue muy difícil, ya que cuando salí positiva de COVID, no se me pagaron por esos días que tuve que ausentarme de mi trabajo. Al mismo tiempo, tuve que cuidar de mis padres, que también fueron positivos, y también no pude exigir que se me pagaran esos días. Sabía que bajo la ley no estaban obligados a pagármelos. Incluso el manejador tomaba represalias, quitándome días de trabajo cuando pedía días fuera para llevar a mis padres a sus citas médicas. Hasta este día, mis compañeros de trabajo han salido positivos y no tienen hasta ahorita el beneficio de esta nueva ley. Y están perdiendo días de trabajo y están siendo afectados económicamente. Gracias a esta nueva ley, sé que puedo exigir el pago de días de enfermedad cuando los necesite, y también puedo usarlos para cuidar a mis padres cuando tenga que cuidarlos, ya que ellos son de edad avanzada. Queremos que todos los trabajadores sepan que tenemos derecho a días de enfermedad pagados, sin tener miedo a represalias. Por eso es importante que nos organicemos en nuestro lugar de trabajo con nuestros compañeros para hacer valer nuestros derechos. Recuerden que un solo trabajador no tiene el mismo poder que tenemos todos juntos. Muchas gracias.
Thank you so much for that perspective and really getting to hear from all parts of New Mexico, because again, this applies to everyone. Now we're going to hear from Reverend Carolyn Wilkinsons at Cafe.
Buenas tardes. My name is Reverend Carolyn Wilkins, and I have the opportunity to speak on behalf of New Mexico Cafe, Comunidades en Acción y de Fe. And I speak on behalf of the organizers, the community leaders, the clergy, and the workers who all participated in this program. We applaud the implementation of the state paid sick leave that's going to begin tomorrow. At the helm of our efforts at New Mexico Cafe are strong leaders who were directly affected and played a pivotal role in speaking to the legislators on behalf of this bill. They showed up time after time at different legislative sessions and made sure that the representatives heard how they were affected, how their lives were impacted, how their children were affected, and how it was a circular, I think they really helped to show that it wasn't just a worker, it was a community, because workers had children to deal with, they had parents to deal with, as well as co-workers. So there was a connection in the community of what we were doing. The policy ensures that workers do not have to fear missing a day of work because they're sick, and have the opportunity to help their families also be safe and healthy. Paid sick leave is really good for business, even though there were a lot of businesses fighting against it. But what they didn't seem to acknowledge is that when you have sick people who are working for you, they make other people sick. But this gives people the opportunity to stay home when they need to stay home, to be sick without losing pay and without affecting customers or other employees. At CAFE, 2 of our own organizers were directly impacted by COVID. They were out in the field with organizers, but they had severe losses throughout their family of 8, 10, and 11 people in their family contracting COVID. So I can speak personally that our organization, CAFE, did provide paid sick leave, and we understood the impact of having that capability. And I speak on behalf of all of our organizers who work tirelessly to bring in community leaders, to bring in clergy, to bring in directly affected people so that they could let the legislators understand that this was a serious issue, and that people in New Mexico deserve to be treated better. So what we do with CAFE, we will continue to do, to listen to the community, to lead campaigns for change that empower the most affected people in New Mexico. And those who are listening, remember, your voice counts. Thank you.
Thank you so much for that, Reverend. And thank you for all the work that you're doing on behalf of all New Mexicans, so many of our working families. And I know that a lot of these stories that were shared, a lot of public comment that was given, I know that our elected officials really did hear all of us and really translated that to help their colleagues in the legislature to understand that as well. And I know that our own pro tem of the Senate really championed that while she was on the floor. So I'm going to turn it over to our pro tem, Senator Mimi Stewart.
Thank you so much, Lan. I am so proud to be here with you all. You all did this. Somos, Ole, CAFE, the Center-in-Law in Poverty, El Centro. You were amazing. And I'm starting to cry now because of these stories. We certainly did it during this session. I am the most proud of my help in the Senate on this bill. This bill, I think, is one of the most significant things we have done for essential workers in New Mexico. I mean, shame on us for it taking so long, and shame on us for not doing this sooner. You know, when the bill came over from the House, it came over with a message that, oh, this isn't going to pass. The governor's not going to sign it. And I said, the hell it isn't. And then we worked together on the amendment to delay it a year. It was good for businesses. They have to get ready for it. I should tell you, they tried very hard to change this bill in January. They had a whole bill drafted to undo so many parts of this bill, and the governor said no. So the governor has been a main supporter and backer of this bill. She just needed to give those businesses a little bit more time. I'm just so proud of all of you for what you did, standing up, your testimonies, your stories, like we've heard today. they really are heartbreaking in a lot of ways. You'd think, you know, in the United States of America, we would always have paid sick leave. We should. It's a justice. It's a right. Yeah, we had to fight to the last minute on this bill. I'm sure you all remember it. I certainly do. In the middle of the night, 3 a.m., the day before we were to end. Thank you. Thank you all for what you've done, for all the essential workers in New Mexico, bringing this forward, sticking with it, and for your amazing testimonies. I've even improved my Spanish after this, listening to everyone and picking up little bits. So thank you again. I'm so proud to work with Representative Chandler, Representative Rubio, Representative Patricia Roybal Caballero, the women in the House. Really feel like they have my back. So thank you all.
Thank you again, Senator Stewart. We all, I think many of us stayed up late that night. Some of us crying, some of us cheering, but I know we'll continue on the cheering portion tomorrow and really celebrating this monumental win. And as you stated, Senator, this is overall movement from workers partnering with our legislators, with our governor, and so many of our families throughout New Mexico, our policymakers really pushing for this to cross the finish line, something that we've been fighting for so long, even though it shouldn't have taken so long. And I know the work doesn't stop here. And so we'll be continuing to partner with you all on so many other pieces of important legislation into the coming session, and know that you, all of our champions here, will continue to be our champions. Next up, we're going to hear really about the perspective of the expanded family definition. I think we've heard from different perspectives, and then also how this plays for our children and our kids and our youth. I know that Jennifer could not be here because, of course, healthcare issues, health issues, and illness does not wait and can impact us at any point in time. So I believe that Michaela with Working Families will read her statement.
Thank you, Lan, and thank you for this space. Jennifer really wanted to be here, but she found out this morning that she had a family medical emergency, so she's with her extended family today. This is her statement. My name is Jennifer Santini, and I'm a healthcare worker with 19 years of experience caring for the elderly, the sick, and the dying. I'm also a member of the New Mexico Working Families Party. I'm passionate about sick leave because I know what it's like to make a choice when there are no good options. Losing pay to stay home with a sick family member, or working and leaving a sick family member alone. My son was extremely ill at the emergency room, burning up with a 106-degree fever. Because I do not earn paid sick leave, I had to choose between staying at the ER with my child or going back to work so I didn't lose my job and the paycheck needed to provide for him. He wanted me to stay. I wanted to stay. No one should have to make that painful decision. It's a relief knowing that starting tomorrow, workers in New Mexico will start earning paid sick leave, and that the law includes an inclusive definition of family. New Mexico workers often care for extended family members. It's one of the things I love most about living here. I help care for my aging family. Under the paid sick leave law, I can take them to their medical appointments without retribution or worrying about lost wages. They don't have to worry they are creating a financial burden for our family. Families are unique, and I appreciate the law recognizing and valuing our uniqueness. We are a community, and having paid sick leave means having a healthier community. Thank you for this opportunity.
Thank you so much for reading Jennifer's statement, and we truly hope that we send our thoughts to Jennifer and hope that things are okay as she addresses that family emergency, and really speaking to how this impacts our future generations and New Mexican values, that oftentimes we step up for each other, whether we are direct family members or not, how we have to in times Even as myself as a cancer patient for the last 11 or 12 years or so, so many of my family members have had to step up. And by expanding this definition, they won't have to worry about affording to put food on the table or to take me to my chemo appointments. So, and as we heard from Jennifer, it really applies to our sick, and it doesn't go just beyond COVID. Illness again does not wait for pandemics. It does not just confine itself to this, and it hits us at any point in time, whether it's something as chronic or something simple as the flu, but yet still very serious. So we're going to hear from another co-sponsor and champion in the legislature about what this really means for New Mexico and for all of our working families, and really truly proud to have seen her in action late into the night as well, Representative Christine Chandler.
Thank you, Solan, and thank you other panelists for attending. And I can't tell you how gratifying it's been to be able to work with Representative Rubio and Senator Mimi Stewart on this legislation. If this is the only piece, if this had been the only piece of legislation that I was able to pass my career in the legislature, I've accomplished something, collect something. We are, I think, the 19 state employers for sick. And I think this is of the fact we are a state and government
Representative, your
body and a collective and people who really care about employees. And we nice. Are you having trouble hearing me? Ooh.
Yeah.
Well, it's sad. I'm at the legislature right now, and I would have hoped my Wi-Fi would have been working. So I apologize. But what I was saying, I hope you heard, is we are one of, I think, 18 or 19 states in the country that require employers to provide for paid sick leave for all of their employees. And it really indicates how we collectively care about our people and how we care about supporting our families. And I'm proud to be part of the movement that will continue these kinds of efforts going forward. And I expect to be working with all of you collectively to continue initiatives such as these. For example, paid family and medical leave is an important initiative that we all need to be looking at and pursuing. That's the next step. And ensuring that families have the support that they need in the workplace. And I want to emphasize too, and I don't think it was touched on much in our conversation, this is an initiative that helps employers. Employers benefit. The studies show that employees who are able to take time off ensure that they don't other employees, they don't hurt members of the public. They also tend to be a higher product and as a team with employer when they have fits this. So this is not only good in the state, and I think they're going to realize this after the law has been in effect for a period of time. They will recognize how significant it is and how helpful to them to have employees who supported, feel supported by the state, and I will let the program move on. But again, thank you so much, and thank you for all your work on this very important issue.
Thank you so much, Representative. You made a great point. We are hearing stories of folks that are seeking employment, but really seeing that depending on the job that they want to go into, do they have these benefits? Do they have these protections, especially as COVID's still roaming, right? And what can they do to protect themselves, their families, and how much cost savings as well that businesses will save in terms of turnover. right? So I think that that's a very important point, that this isn't just for workers, it's for all New Mexicans, including business owners. We have seen the data and how much this helps. And as folks look at new employment opportunities, this is certainly one of the benefits that so many of our families are looking forward to. And so thank you for really bringing that up. Again, I know that we are getting questions in the chat from members of the press. We're going to wait until the program's ended. We have just one more perspective to really share until we go to the Q&A portion. So thank you for those that are sending their questions through the chat, and we'll be fielding them to the appropriate person to answer those. So now we're going to turn this over to Yolanda Munoz.
Buenas tardes, mi nombre es Yolanda Muñoz. Soy miembro de Somos un Pueblo Unido desde hace 7 años. Tengo viviendo en Haas, Nuevo México, 17 años. Soy casada, tengo 2 hijos. He trabajado en limpieza de cuartos en un hotel por 15 años. Yo vivo de cheque en cheque y no puedo darme el lujo de faltar al trabajo, así esté enferma o tenga que cuidar a un familiar que lo necesite, porque saldría muy corto mi cheque. Y en estos tiempos tan difíciles se necesita el dinero. Pero con esta nueva ley, días de enfermedad pagados, podré tomar estos días para poder descansar y recuperar mi salud. Esperemos que con esta nueva ley todos los empleadores la cumplan, porque es un beneficio para nuestra comunidad trabajadora y esencial. Porque también nosotros nos enfermamos y necesitamos estos grandes cambios. Pero si los empleadores no la cumplen, ahí estaremos nosotros los trabajadores. En una comunidad tan rural como Haas, no podemos depender de nuestro gobierno local, ni a veces en el estatal, para reforzar o implementar las leyes. Así es que ahora más que nunca, será importante que nos organicemos y demandemos este nuevo derecho que nos hemos ganado. Es importante recordar que fuimos los trabajadores a través de todas estas organizaciones que ganamos este derecho. Ahora es nuestra responsabilidad cumplir la ley.
Thank you so much for that, Yolanda, and really closing us out on a strong perspective that, you know, these laws and protections benefit all of us as a community, and what that can mean for all of us. So again, thank you all for attending, for sharing your heartfelt stories, how policy comes into play and humanizes really legislation and what this means for New Mexicans, that these are New Mexican values. So I just want to say thank you, and thank you to our interpreters as well. And we're going to turn this over now to the Q&A portion. And I know that some questions were somewhat answered in the chat, but I do want to just bring this up for members to address. And I believe that either Senator Stewart, if you're still on, or Representative Chandler, if you could take this question, but this comes from Austin Fisher from Source, New Mexico. Is the Department of Workforce Solutions prepared to handle complaints filed under the Healthy Workplaces Act?
Well, let me just say, Lon, that they're very organized. They have produced the little chart poster that is required now for employers to post, so their employees can see what their rights are. It's given by not having this go into effect for a year, it's also given Workforce Solutions to do that. In fact, earlier in the chat, there was a link put in there from Workforce Solutions on how you can look at see your rights. So I think they're ready. And even if they're not, we're going forward.
Thank you for that, Senator Stewart. Again, this was delayed just a bit to allow our business community to really learn some of these practices and get their foundations set. So, you know, just as a reminder, you know, this isn't a surprise, in other words. And so, you know, we have this infrastructure that's set out. And again, those links were set in the chat, and we can fill that out to members of the press, and also for those that are watching that are still curious about how they can file complaints. And we've heard from Felipe as well as, when do you start accruing hours? What can you do? Just to have these clarification points for our business community and for our workers. The next question is, I'm going to maybe send this to Representative Rubio, but low income and Black brown workers in the US lost more work than others during COVID-19 case surges. According to an analysis of census data between August 2020 and June 2022 that was published on Tuesday, other studies have found that when COVID-19 disrupts a worker's income and schedule, not only suffer from short and long-term health effects of the disease, but also do not have enough food to all, especially when there's no paid sick leave available to them. Should policymakers and leadership be expanding their definition of who is high risk of severe illness if infected with COVID or coronavirus to include Black, Hispanic, Indigenous, and low-income Americans? From Austin Fisher from Source, New Mexico. Either Senator Stewart or Representative Rubio.
Thanks, Len. I mean, I certainly think that there should be a conversation around that, but not necessarily just around COVID, but we have to have that conversation when it comes to just issues around any type of public health issue that we're facing, especially in a state like ours. I think, and when it comes to policy, I know that it's a lot harder to have this conversation in terms of expanding definitions, but I certainly think that it's valid to consider those options moving forward. And like I said, again, not necessarily just for COVID-19, but for other public health issues.
Let me also say, Len, the House, again, the House women, Representative Rubio, Representative Chandler, also were offering a Family Medical Leave Act this year. We couldn't do both, so we did a memorial to set up a workforce. That's happening right now to look at how we do a state paid family and medical leave. So we're hoping that by January, we'll have a good idea of how that might work. I'm assuming those House members will jump right on board, and I certainly will in the Senate. That will take also a little bit of the issue around a longer term family and medical leave. So we're working on more issues than just paid sick leave.
Thank you both so much for that. As we know, illness does not confine itself to a pandemic. COVID-19 has only illuminated so many of these impacts to our families, and disproportionately so to our Black, Indigenous, and communities of color. And it's a very nuanced issue. Of course, it won't be solved by having paid sick leave, but it's the first step in the right direction to help so many of our families. And I want to thank, I know all leadership that's here and our elected officials have been championing for paid family medical leave for so long as well, almost maybe even longer or the same amount of time that we've been fighting for sick leave. And so, that fight continues as we've stated, there's so much work to continue to do for all of our families, and just appreciate them for continuing that fight. One question, and either this could be fielded to Senator in Long Poverty as well. A member says, was offered a second grade teaching position at a private Christian school, and they said that paid leave does not apply to them. Is this true? What employers are required to cover are covered by this law?
Well, I mean, if I could weigh, I'm sorry, go ahead, Felipe.
No, go ahead, Representative Chandler. You can weigh in.
It applies to all private employers. And so I would say that it applies to that particular charter school. So talk to Felipe. I'm sure he can help you with that, but it's definitely applies to all private employers.
Now, the charter schools are covered under the public school code, but this sounds like it's a private religious school.
Yeah. That
should be covered, just as Representative Chandler said. It's all private employers. Right, Philip?
Yes,
I'm glad to have our current attorney here.
yes.
Not, we may need to amend the bill.
This goes into effect tomorrow. So possibly that's the question there. Maybe it didn't apply to them at that moment, but again, this goes into effect tomorrow. So just to clarify that point as well. One follow-up question from Austin Fisher is about the Department of Workforce Solution. It's good news that they are publishing notices about the requirements under HWA, but does DWS have enough case investigators and support staff to handle the complaints that will come in under the Healthy Workplaces Act?
Well, we certainly increased their budget for this specifically. Most of our state agencies really struggled under the pandemic, and they're still struggling. We will continue to look at this and adjust the budget upwards for that department if they need more. They're not shy about telling us when they need more workers. Certainly the three of us here and other people that want this to work will pay attention to that going forward.
Thank you so much for that, Senator Stewart. I know that that's always an issue as we talk about our budgets and receiving complaints and our overall workforce. It's not just within our state. I know that certainly the city also tried to address this as well, to receive complaints at the city and how they can defer them out. So I know that we're coming close. It's already 1 o'clock. So I know that for folks that have additional questions, especially about how this comes into play for application and what resources you have, ways that you can file complaints, how to track, how many hours you actually get under this law. And again, Felipe really highlighted that early on during the press conference. So again, thank you all so much, from all of our workers to our champions in the legislature, to our organizers, to our community and our advocates that have fought for this for so long, for the folks that again called in on their lunch break or as they were stocking shelves, whispering under public comment about how much this could impact them. You really moved the pen, so to speak, when it came to the signing of this law, and really how much families will sigh in relief and no longer having to choose between providing for their families or going to work sick. We've heard this from perspective of those that have had chronic illnesses, for those that have had emergencies come up, and even for our kids when they're sick, or nieces and nephews, what we can do to really take care of our families, and even how much this benefits our small businesses, and how we can retain workers and really have that cost benefit analysis of not having to pay more in turnover. I just want to thank everyone from the bottom of my heart, especially, as a cancer patient who's had to deal with this as well, as someone who championed this and tried to pass this, and seeing it go into effect, how much this really does mean for all New Mexicans. And again, thank you to our interpreters and all of our tech folks, all the folks at Olay who really had to navigate Zoom worlds, because I know how difficult that can be. And thank you all for watching and attending and being in this fight for us. And as we have heard, the fight goes on. So we truly hope you'll stay active in this fight, and for all of our workers, lending the support where we can at this next session, and really voicing our needs to our communities and to our elected officials, because as Reverend Wilkins mentioned, our voice matters. It is powerful. We can move policy, we can move mountains together. So thank you all again for attending this press conference, and whatever additional questions you may have, you can certainly send it via email. So thank you.